The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Today's tip is part 2 in my 3-part series on how you can improve rotation without hurting your back. Now, today we'll focus specifically on exercises that help us learn how to resist rotary forces. That is, we're going to work on your braking system. Now, I know it sounds strange to work on resisting rotation in a series that's meant to improve rotation, but just as you wouldn't want to drive your car very fast, if your brakes didn't work, your nervous system really doesn't want you to rotate very far or very fast if you can't resist rotation well. Now, why would I think that you can't resist rotation well? Well, research tells us that in most people who have suffered with chronic low back pain, even just for a couple of months, the muscles that resist rotation, specifically multifidus, if you'd like to hear a name, are not working properly. That is, they've been inhibited by your nervous system or unplugged. They are offline. And so what we must do if we want to learn how to rotate better, if we want to put rotation back into our lives, which as humans, we need to be able to rotate at least some, then we've got to get these muscles working again. So today we'll focus on 2 very specific exercises to do just that. And I want to remind you that when we're doing these exercises to stimulate muscles that have been shut down by the nervous system, it's really important to pick a variation that you can do very successfully. No pain, no strain. If you are straining in your exercise, then you are likely compensating with other muscles and you're not getting the lesson we're trying to teach. So be sure as I offer you different variations, different levels of intensity, you pick the one that you can really win at, and then you slowly progress yourself as you're getting better without strain. Okay, now exercise number 1, you're going to need a raised surface. I've got an aerobic step right here, which is about as low as I'd want you to start with if you're pretty strong. Now, for many of you, a countertop would be much better. And the reason is that you're going to have more weight in your feet, less weight on your arms, and that's going to make this exercise much easier on you. But this is the surface that I have available, so I'm going to demonstrate it here. It may be a progression for you. So what we're going to do is start out with our hands on that raised surface and the feet out behind us in a strong plank position. So you've got to make sure your body is straight, your head is aligned with your spine, your low back is neutral, not straight, but neutral, and your abdominals are very much engaged. So I've got that compression and bracing action going on to keep my body really straight here. Now your feet probably need to be at least shoulder width apart to give you good balance. And then what I want you to do is as you exhale, you're going to compress your abdominals a little stronger and just lift the foot off the surface a little bit. Place it back down. Exhale, tighten those abdominals again, and lift the other foot up. Now notice I'm not lifting very high because the objective here is to resist rotation. So I want my hips and my shoulders to stay level with every repetition. So you can see that if I really raise my leg up high, I might arch my back a little bit, and then I also will lose rotation, which is killing the reason we're doing the exercise. So once you feel like the feet are fairly easy and you've got that, you can also try raising a hand. And once again, you don't want to raise it too high. We want to keep the shoulders level and avoid rotation here. So 1 to 2 sets of 5 repetitions is plenty for this exercise. Now, before I go to the second exercise, I just want to remind you that if these tips are helpful to you, please share them with your friends and family. We really need your help getting the word out so we can help more people. And of course, by all means, click like, click subscribe, click all the buttons, and enjoy these videos because I really do enjoy making them for you. All right, now, our second exercise, we're going to go to the floor, and this one will probably look familiar to you. I'm just going to move my step out of the way here. So this second exercise is a pelvic lift. And you're probably familiar with this from all different sorts of disciplines. In this particular exercise, I want you to keep your spine relatively neutral. So we're going to try to avoid rounding the back or arching the back at any point in the exercise. So the start position is just to exhale, Keep your abs nice and tight and press down with your heels to raise your hips. They don't even have to be fully straightened here. But here's where the challenge comes in. You will next either lighten, which I'm lightening here. You can see I'm lifting my left heel. Or if you've got it and you're not going to lose your level pelvis, you can actually lift your foot, and that's going to challenge your body to stabilize against rotation. So to be clear, if I lifted my foot and my whole pelvis twisted down, I'm losing that battle. I'm no longer resisting rotation, and that's going to probably wind up hurting my back, as well as obviously not win the objective of the exercise. So we really want to keep the pelvis level here. So once again, you're going to exhale, compress and tighten your abdominals. You can lighten one foot if that's enough of a challenge. If you've got the strength, you can actually lift it. So once again, make sure that you're picking the variation that works best for you. So I can do the next couple of repetitions just lightening the foot here instead of lifting. Now, I would say probably 2 sets of 5 repetitions on each side is plenty for you. Maybe start out with 1 and make sure that you're super successful with 1, and then as you become more accustomed to the exercise and feel like it's getting a little easier, add a second set. As always, I hope these tips are useful and helpful to you. Please comment, let me know what you like, let me know if there are other topics you want me to cover, and as always, keep moving and be well.